wide discussion in performance enhancing drugs PEDs by male users, but not so much in female users. So this video will discuss the use of drugs by women and also their effects on the female body. So PEDs come in a variety of factors, the most common being anabolic steroids, erythropoietin EPO, human growth hormone, beta blockers, stimulants, and diuretics. Now, these are used by a variety of sports people, both male and female, and often they have similar enhancing aspects as well as similar detrimental effects. However, I believe that the female detrimental effects are often overlooked because of the common misconception that many female athletes do not use PEDs, but this is not the case. Obviously, the positive aspects of PEDs are stuff such as increase in strength, increase in muscle mass, increase in athletic performance, endurance ability. But there are, of course, medical and physiological disadvantages which can be lifelong and sometimes fatal. So to begin with anabolic steroids for women, what happens is that women become more masculinized. So this means that their voice deepens, they get reduced fat muscle mass, and they also get, because of that, reduced breast tissue, and they can suffer from what is usually termed as a male condition such as male patent balding, and they can also get coarser or rougher skin. Now, some of this sounds quite small and petty, but obviously physical appearances do matter, and bodybuilders know that. And some of these changes are non-reversible even after you stop taking anabolic steroids. And if that's not enough, steroids, especially in teens and young women, can also affect their fertility by affecting the release and the development of eggs or ovaries. Now, this is obviously very detrimental to young women, and if it persists when they do want to have children, this can greatly diminish their fertility and their ability to conceive, which is quite life-changing. Because these hormones are synthetic and they're also not natural at the levels that they're taken in the female body, they can also impact a woman's menstrual cycle, and they can also change the physical characteristic of her clitoris, so making it permanently enlarged. And hormones such as testosterone can also flood the woman's system and make her very aggressive. So there are some crossovers and shared symptoms such as the buildup of fat in the arteries, the enlarging of the ventricles of the heart, higher blood pressure, more likelihood of suffering from heart attack, increased likelihood of suffering from a stroke, liver tumors, as well as stunting growth in teens because they are forced to grow at a quicker rate earlier but stop even earlier because of these artificial hormones and drugs that they're taking. There are also other indirect side effects caused by the lifestyle, such as using dirty needles or sharing needles to inject these PEDs, which means that you can get HIV, hepatitis B and C, as well as any other fluid or blood-borne illnesses. So as you can see, the list of disadvantages is endless. And it's not exhaustive. So other than the various organ failures that you can suffer from and the heart-related illnesses, as well as the physiological changes, it's really not a good idea for many people to be using these PEDs just for physical attributes or benefits, even with the assistance of a healthcare provider, because ultimately it's not something you should be putting in your system. It's not something that your body naturally creates by itself at such high levels, and in the long term it's not going to be sustainable, and you don't want your body dependent on man-made pharmaceutical agents. Please like and subscribe and share your comments about what I've just shared. Thank you.